at the EASD, we talked about the COVID-19 and diabetes and the independent risk association between both type 1 and type 2 diabetes and also COVID-related deaths. Of course, there are many risk factors for poor outcomes, including assisted ventilation, admission to ICU, and also death in people with COVID-19. These include advanced age, pre-existing conditions such as heart disease, kidney failure, and also stroke, and also obesity. But even after we adjusted for these risk factors, both type 1 and type 2 diabetes, people have 2 to 3 times higher risk of having an adverse outcome if they get COVID-19. Of course, people with diabetes are different. In a young person with type 1 diabetes who are very well managed with no complications, the chance of survival is very good as compared to people who have long-standing diabetes, who have multiple risk factors and poor control. Their outlook is poor if they get COVID-19. And the independent association between glucose level and also poor outcomes in COVID-19 really highlight the importance of optimal glycemic control, not just during inpatient management, but also in the outpatient management. Because during acute illnesses, people with diabetes who have who cannot actually regulate the glucose effectively, under those stressful situations, they become particularly vulnerable when systems can fail. And also we discussed the importance of insulin, right, in the session, because really people with diabetes, the main primary defect is actually inadequate insulin action, either qualitative or quantitatively. And this is very important to ensure the person can utilize glucose as an energy source effectively. So during inpatient management, the insulin use is important. And I think healthcare providers need to be aware of this, because really not just COVID-19, but there have been a lot of studies showing that people admitted to ICU, a medical ward, or surgical wards for whatever reason, good glycemic control using insulin is actually associated with good outcome, provided these are used carefully with low risk of hypoglycemia. But of course, the key question is even the glucose on admission has prognostic significance, and highlighting that really outpatient management of diabetes is important. Diabetes is a very complex disease, it's very silent and progressive. These people can have multiple risk factors, and people have to live with diabetes for decades. And it highlights the importance of really self-management and also knowing what are the risk factors, what are the sort of things that they should do to protect themselves during sick day, for example, the importance of good lifestyles, as well as having regular follow-up and being adherent to the medications. And during the lockdown in many countries, many of these people with diabetes or chronic diseases, they do not have access to care. And it's really a crisis that has posed challenges, but at the same time opportunities where care providers have sort of used the technology to help manage these individuals, particularly like in type 1 and also in some people with type 2 diabetes. And I think here, we have always been sort of talking about how do we make care more accessible and also more affordable for people living with diabetes for decades. And I think this is really an opportunity for us to rethink and reform the way how we deliver care, so that these people really can be more empowered with their risk profiles in order to manage their conditions more effectively. But during the discussion, we've also highlighted that social disparity and care disparity is a really major concern, and that is on top of these two epidemics of COVID-19 and also diabetes. We now have this epidemic of social and also care disparity. which really call for a more systematic approach, including policies and also reform the system, so that these disadvantaged communities are actually not denied care, and also to ensure that they also can be protected. Otherwise, you see, we will be having problems, on the healthcare system. So I think the COVID-19 and also diabetes really highlight the complexity of our new world, where everything is interconnected, political, economical, social, and also technological. In many ways, diabetes and COVID-19 they share similar premises. These diseases are silent and serious, and if they are not well controlled or not diagnosed, they can collapse the healthcare system. And yet they are potentially preventable and treatable. But to do that, we really need collaborative efforts, including government leaderships, intersectoral collaborations, and also individual participations supported by science and also data. So as we actually we hope we will soon get out of this COVID-19, but we hope everybody will need to rethink, as to how we, as an individual, as an organization, and also as a community, to try and change the fate of these big population of people with diabetes, so that they are protected, and in order to reduce the risk of having these devastating conditions, so that our system can be sustainable.